Good morning. It's Sunday, April 25th. And as most of you know, I grew up in the Bronx. I lived in the Bronx for the first 33 years of my life. And in 1955, the Bronx was cut in two by the Cross Bronx Expressway, which runs all the way up into New Jersey, and then some side roads will take you off into New England. And I never really thought about the physical impact of the Cross Bronx Expressway until this morning when I was listening to the news. And people who grew up in that part of the Bronx, which is called the South Bronx, but it's really not that far south. And it's not a wealthy neighborhood. And there are many people there who are suffering from what I will call breathing diseases, asthma, and various other things that affect your lungs. And a main contributor to those illnesses is the Cross Bronx Expressway, because it is a major thoroughfare. It is constantly in use, and it's not in use by automobiles. There are huge trucks that drive back and forth on the Cross Bronx Expressway. And the fumes that they emit, as we all know, are not very good for us to be constantly breathing in. So the Bronx Congressman Torres has requested that somewhere in the stimulus packages that there be what is called a capping project. Now, this type of project has been done before. It was done in Texas, and it was done in parts of Los Angeles. But none of them would be the magnitude of the Bronx capping project, the Cross Bronx capping project. Now, what is a capping project? Simply stated, they're going to build a concrete ceiling over the expressway, 2.5 miles of concrete. And on top of the concrete, they're going to place lawns. I'll call them lawns, for lack of a better term. Grass areas with paths so that people can walk across the expressway and people can communicate from both sides of the expressway. And in addition to the grass, which will get rid of a lot of the carbon dioxide that is being spewed from the trucks, they will probably plant a few trees, and maybe they'll even have a playground or two, and they are going to have a ventilation system that will capture the carbon dioxide that is being spewed into the atmosphere in that area, filter it, and send it racing upwards, not into the lungs of the general population, but into the atmosphere. And that's what the other capping projects have done too. So this is not a unique solution, but it's a big one, a magnificent project if they can pull it off. And the estimated cost of this project would be less than $1 billion. 760 million, supposedly. Now, we know that this is not a 2-minute project, so it's going to drag on probably. So I would estimate that it will end up costing $1 billion before they finish with the cost overruns and everything. But we're talking about somewhere like 250,000 people that live in that area, maybe a little less than that. And many of them are sick. So this is a health hazard. The Cross Bronx Expressway is a major health hazard. So I think that money spent on a project like that is well spent. Now, of course, I know that there's going to be a big fight about this in the Congress and in the Senate, because there's a big fight about everything we spend. But when I look at the overall picture, much of the money that's being spent in stimulus packages will be money well spent. Now, we may not all agree on everything that's in the package, but when the health of our citizens is greatly endangered, I think a project like that needs to be moved to the front. And maybe I'm a little prejudiced about the whole thing because I grew up not far from that expressway. I know it very well. When I had a job in New Jersey and I drove half of the Bronx Expressway to get across the Washington Bridge and into New Jersey and get to work every morning. So I'm familiar with the volume and the speed at which you go and how much of it. And I know the speed at which we traveled. And it was slow, and we were spewing much unhealthy stuff into the atmosphere. So in my mind, the congressman from that area is 100% correct, that this would be money well spent. And I don't know how many other places around this country where money would be well spent to save the lives of our population and reduce the outrageous medical expenses that go with the unhealthy atmosphere that we are breathing in. There should be more projects like this. These are the types of things that we should be looking for. But in many parts of this country, there are people who don't live in populated areas like the Bronx or Brooklyn or Los Angeles. They live in the wide open spaces. And those people have a different view of the world, as we have seen in the past couple of years. So they're not faced with these kinds of health hazards that are man-made. And it's going to be a tough sell to win those people over to save the population of a couple 100,000 in the South Bronx. So I'm glad to see that a project like this has made headlines. I'm glad to see that there are people out there who are trying to help others who are less fortunate. Because I can tell you that the people that live in that section of the city are not wealthy. They are the impoverished. They are low paid for the most part. They're the people who bus in restaurants, wash dishes, do janitorial work, and lug things around their whole life. So at least if they're willing to do the menial low paid labor, they are entitled to a healthy atmosphere for themselves and their children. And so that's my rant for this morning, and I will see you tomorrow. Bye.